Good morning, class, and welcome to our virtual classroom. Today we'll be having Abby, Allison, and myself, Michaela, teaching you today. Today we're going to be learning about the axillary nerves, and we are going to be learning about the anatomy, the pathways, and the risks with injury. So the function of the axillary nerve includes the motor function and the sensory function. The motor function innervates the teres minor and the deltoid muscles. The sensory function gives rise to the upper lateral cutaneous nerve of the arm, which innervates the skin over the lower
We'll be talking about the physical anatomy of the axillary nerve. So the axillary nerve is actually a part of the brachial plexus. It derives from the posterior cord of the brachial plexus. The axillary branches from the posterior cord and descends in the axilla posterior to the axillary artery and anterior to the subscapularis. The axillary nerve then travels through the quadrangular space in the arm, which is a triangular opening formed by the shaft of the humerus, the long head of the triceps, the teres minor, and the teres major. The axillary nerve then moves around the surgical neck of the humerus and branches off into two main parts, the anterior terminal and posterior terminal branches. The anterior terminal innervates the upper deltoid muscle, and the posterior terminal innervates the teres minor and a small portion of the deltoid. Take a look using some bones. So, the axillary nerve is going to travel down through the arm, through the shoulder, and it's going to enter the quadrangular space, move around the surgical neck of the humerus, and branch into two branches here. The anterior on the upper portion and the posterior terminal branch on the lower portion.
Next, we are going to talk about the risks with injury to the axillary nerve. So there are two main points in the anatomy that could be injured, so trauma to the shoulder or trauma to the humerus. And with the humerus, fraction of the surgical neck of the humerus is most common. So risks and types of injuries here would be compressive force to the shoulder or the humerus, car accidents, fouche, which is falling on an outstretched hand, sporting or athletic injuries, forced abduction of the shoulder joint, or an anterior dislocation of the shoulder. This could be caused by a traction injury, which is also known as a stretch injury. This is a mechanism that causes brachial plexus injuries. The nerve of the brachial plexus is damaged due to the forced pull by the widening of the shoulder and the neck. Traction occurs from severe movement and causes a pull or tension among the nerves. Finally, a rotator cuff injury could also hurt the axillary nerve.
Next, we're going to talk about the signs and symptoms of axillary nerve injury. Pain to the area of the deltoid and anterior shoulder. There's also loss of movement and or lack of sensation in the shoulder area. Reported or observed weakness to the deltoid and teres minor muscles, abduction, flexion, or external rotation. Feeling of instability of the shoulder. Also fatigue, especially with overhead activities, heavy lifting, and or throwing.
So how would you determine if you had an axillary nerve injury? First, you would get a physical exam, and you could also determine if you have an axillary injury by an EMG, an MRI, or an MMT.
So there are several different ways to treat an axillary nerve injury, and these would depend on the severeness of the axillary nerve injury. The duration of recovery of this type of injury can be lengthy, up to 35 weeks to fully recover. Surgery is the most common medical management. There's also non-surgical physical therapy treatments that can be utilized, or non-surgical reduction, which includes immobilization of the joint, ice, and rest.
Thank y'all for joining us today, and that's a wrap. Bye! Like and subscribe!